Right. Thank you, everyone, for joining us today. We're excited that we have Sharon Murphy and Geraldine Stoltzfus, who are joining us from ECRI to present today on understanding patient safety organizations and their benefits, with a spotlight on ECRI and the ISMP PSO. Sharon is the Director of National Accounts at ECRI, an independent nonprofit organization improving the safety, quality, and cost effectiveness of care across all healthcare settings. Sharon's primary role is to provide solutions to ECRI's medical professional liability insurers and their acute, ambulatory, and aging services client organizations. Solutions encompass ECRI's full suite of evidence-based patient safety risk management, quality and medical device technology, online resources, education, risk assessment, and consulting services. She is involved in client support, product development, account management, marketing, and sales, and she has been with ECRI for over 30 years. Geraldine is a highly experienced leader and registered nurse with a diverse healthcare background encompassing acute and chronic disease management, care management, patient-centered, medical home, operational and practice management, and quality initiatives, tracking, and extensive event analysis. Geraldine's educational background includes a BA registered nursing background and a master's in business administration with a concentration in healthcare management. In her current role as the Associate Director of the ECRI and ISMP Patient Safety Organization, Geraldine plays a pivotal role in advancing healthcare safety on a global scale. Please turn your attention to Sharon and Jerry as they begin their presentation.
Thank you so much, Alex and Ava, and it's great to be here with all of you this afternoon. And with that, we're just going to jump right in. So, of course, we have our disclaimer that the views and opinions that are expressed during the program are those of us as the speakers and do not necessarily reflect the views and opinions of ECRI and the ISMP or the Institute for Safe Medication Practices, PSO. In addition, the information provided by us and or ECRI and the ISMP practices does not constitute medical, legal, or business advice and is provided purely for informational purposes. This has some contact information here on this slide for you as well. So our learning objectives is to comprehend the role and the purpose of PSOs, gain an understanding of the Patient Safety and Quality Improvement Act, or the PSQIA, identify the benefits of working with a PSO, learn how a PSO, what it is and how it functions, highlight how PSOs can support legal and risk management practices in healthcare settings, explore the advantages of collaborating with a PSO for healthcare organizations, and then explore ECRI and the ISMP PSO and discover the specific features and services offered by us at ECRI and the ISMP PSO. So I did want to share a little bit about ECRI and how we got started. It was actually in 1968 that Dr. Joel Noble, he was a staff member, a provider at the Presbyterian Hospital at the University of Pittsburgh Medical Center. And he was caring for a 4-year-old patient who unfortunately died to a faulty bag valve mask. Dr. Noble, who had alerted others on the staff several times that it was not working properly, was deeply affected by the child's death. And later he was quoted stating, "Anger is a great source of energy." Creating the MaxCart, one of the prototypes that is pictured here on this slide, which is now commonly called a crash cart, is also showcased in the Medical Smithsonian today. Dr. Noble went on to test a lot of other devices on the market and really that he found were ineffective. After failing to find anywhere to publish his findings, he set up, originally we were called Emergency Care Research Institute in the 1960s. He went on to, publish about journals and information. And today we remain a nonprofit organization and we have grown over the years. And I'm going to just share a little bit more about us. In 2020, ECRI, we signed an agreement with ISMP, or Institute for Safe Medical Practice, They are the only medication safety gold standard and also a nonprofit organization devoted entirely to preventing medical errors. And we were very excited to have them join us as a PSO affiliation. And then in 2024, at the end of last year, we were also very excited to have the Just Culture Company join us as well. And this really created that partnership, that we can become that single source for safety that provides that unprecedented expertise in multiple areas of the organization and within healthcare. In 2024, we also felt that we had some breakthrough with that. We led some conversations about safety at the highest levels. We had a seat at the most prestigious meeting of thought leaders, and through Marcus, our CEO, with top leaders of ECRI, we drove conversations where safety needs to go. And we're hoping we continue on that pathway within the US and also globally as well. Some of our shared services and our affiliations, and this really creates that breadth and awareness. So I'm not sure if you're familiar with our top 10 publications. We do this every year. We have a focus. One of them is towards health devices, and one of them is towards patient safety. But the framework of how we come up with those top 10 initiatives that we are really trying to determine what we're going to be publishing on really is across our evidence-based medicine, not just within our patient safety organization, but also with our technology and that decision support, which is truly really important. Our staff is made up of over 500. And again, we are a global organization. So we kind of look at ourselves that we have a lot of expertise, similar to in patient care settings, in the acute and the chronic care in the hospitals as well. But we really value our physicians, our nurses, our professionals that are coming from different walks of life in quality, risk management, and patient safety. A lot of the framework that we have built within ECRI, and specifically within the last several years, is built on the total system safety approach. And really what we want this to be is that pathway for eliminating that preventable harm, making it a safe system learning that incorporates a lot of the elements here on this slide. So what I want to do is I just want to read a little bit of a case scenario. So we have a delayed referral of diagnosis. I'm sure all of you have had some type of a situation that you can is relevant. So we know that delayed referrals and diagnoses, they can represent a failure in multiple areas, often overlapping and finding causes in several domains. The patient presents, with symptoms to indicate a serious condition, but due to a breakdown in the referral process, the patient is not referred to the specialist in a timely manner. This delay leads to a late diagnosis, resulting in the progression of disease, which is more complex treatments and increased distress for the patient and their family. So how we're approaching this from that total systems, if you look at this from the physical environment, there could be a design in the work environment that minimizes distractions or interruptions. Are we doing the best that we can so that providers can focus on that patient and those assessments and those timely referrals? Looking at it from a task and a process is to implement strict adherence to referral protocols. Do we have automated alerts or checklists to ensure that timely follow-up? Tools and technology, making sure that we're using reliable electronic healthcare records. Do we have that it might be built in, that it's automated? Are we tracking the patients in that progress? From the organization, we want to improve staffing practices and that support structure to include clear communication protocols between all care settings in the primary care, the clinical support staff, and the specialists. Looking at it from a people, we want to provide thorough training and ongoing support to our healthcare staff, ensuring they understand and follow up on those referrals or that diagnostic protocol. And then that external environment, which is so crucial, that we are collaborating with external healthcare providers, our specialists, to ensure timely availability of our consultations and navigating the regulatory challenges effectively. So let's just take a little bit of a step as far as what is a patient safety organization, or a PSO. Our role is to collect and analyze confidential patient safety information, providing legal protections to healthcare providers and organizations that are participating in the reporting system. And as ECRI, we were deemed the 8th PSO by AHRQ. The purpose, even looking at this from the act of the PSQIA, that Patient Safety Quality Improvement Act, is truly to improve patient safety and healthcare quality. We want to encourage that voluntary reporting and analysis of medical errors and adverse events. The president at that time, which was George W. Bush, who had signed this into law, emphasized the importance of obtaining accurate information about medical treatments, highlighting the goal of reducing medical errors that cause injuries and death. And as the role of AHRQ, of the deeming status, they are providing and ensuring that we, as ECRI, meet the criteria for the expertise and then those resources that Sharon's going to be talking about in a little bit as well. We also offer the legal protections, that confidentiality and that privileged status of a patient safety information. And it allows healthcare providers to share data without that fear of legal repercussions. And that we know, and that our goal is that impact on healthcare, that we're analyzing the data, we're identifying those trends, we're developing strategies for improvement, that we can disseminate the best practices to enhance patient safety across the healthcare systems. So a little bit more about patient safety, quote, in a nutshell. It was really a response to the report To Err Is Human, which I'm sure all of you are very familiar about, published in 1999. Describing patient harm due to medical error across the continuum of care. And then this law legally, is part of those protections, that mechanism that organizations are reviewing that information about patient safety and quality improvement activities, which includes, those near misses and those patient harm events. So, linking back to that TSS that I talked about, that total systems, the Patient Safety Organization, our goal is to share, learn, and protect in a culture of safety. So again, the patient safety and quality information about healthcare delivery can be legally shielded from discovery demands or other demands for disclosure, even by state and federal regulators under the specific conditions of the Patient Safety Act. These protections are sensitive information and are really quite valuable to our organizations, but we also make sure that there could be any statutory terms and conditions must be met. Unfortunately, with a bit of effort and some rethinking about how information within a healthcare system is used, handled, and mandated, the Patient Safety Act really is the benefit of accessible healthcare, and that you can learn from it and glean information from the organizations as well. Some more acronyms, which healthcare is built upon a plethora of these. But again, the Patient Safety Organization allows that federally certified third parties to receive confidential information, and that is legally, and it provides objective analysis to really advise clients, our partners and our healthcare organizations on an aggregated non-identifiable basis. PSWP, or Patient Safety Work Product, is really that designation of the confidential, sensitive information pertaining to the quality and care delivery of the Patient Safety Act, and that process improvement within healthcare organizations. And then we have our PSES, which is the Patient Safety Evaluation System, which is really that internal, quote, program or that policy that each organization develops to determine what they want to qualify as patient safety work product. I know it's a lot. and it can take years in looking at all of this information. So really the purpose again of the PSES is to outline the different tenets or a policy document to strengthen the patient safety enterprise, because discussions and documents can be created candidly and analyze without fear of those external repercussions. The challenge is to have that culture that does not threaten the internal repercussions, that is just really a culture without the resort to that blame functionality. This slide here might be a little bit easier to kind of look at. So when you're establishing that patient safety evaluation system, it's that collection, the management or analysis of safety related information for reporting to a PSO. It includes all ways in which a healthcare organization reports, investigates, documents, analyzes, and also communicates information about safety events and their efforts to improve safety. This here is really just some of those examples. Patient safety work product may identify the providers involved in the patient safety event and or provider employee that reported the information about the patient safety event. And PSWP may also include patient safety information that is protected health information as defined by the HIPAA privacy rule as well. On the left here, PSWP is data which could improve patient safety, healthcare quality, or health outcomes. It's data that's assembled or developed by a provider for reporting to a PSO and are reported to a PSO. It also includes data which is developed by a PSO to conduct the patient safety activities. That's that analysis, that's that feedback as well. And then on the right-hand side is really showcasing what PSWP is not. It's information that may be collected, maintained, or developed separately or exists separately from a patient safety evaluation system. A lot of times, this is your EMR. That is not necessarily considered patient safety work product. However, if there is an event that occurred as a result of something that was identified, such as an overdose in a medication, even though that may have been captured in the EMR, what is the investigation of that event is deemed patient safety work product, which would fall in line with what is on the left-hand side of this slide. So again, as an AHRQ-listed PSO, we must perform 8 essential patient safety activities to support our healthcare provider clients, our partners, our members. The efforts are to improve patient safety and the quality of the healthcare delivery. It's that collections and the analysis of PSWP, the development, the dissemination of information regarding patient safety, such as those recommendations or those protocols, or that maybe it's a feedback based on an RCA that may have been submitted to us. It's the utilization of the PSWP for purposes of engaging that culture of safety, maintaining the procedures to preserve the confidentiality. It's the provision of appropriate security measures with respect to PSWP, the utilization of qualified staff, making sure we have the right certifications, the right staff that are being able to partner with our clients, and then activities related to the operation of the patient safety evaluation system and to the provision of that feedback and the participation. So some of the value of belonging to a PSO is that hopefully we are partnering to reduce the harm by integrating and identifying and eliminating some of those costly risks, such as medication errors or surgical complications. It is also to detect safety threats through event analysis and trend identification, like spotting patterns in patient falls or infection rates. It's that secure space for sharing safety data, ensuring confidentiality, and encouraging more extensive reporting. Address issues with experts, looking at maybe healthcare areas or looking at it from an EMR and a downtime. Again, back to that costly adverse events by mitigating emergency safety concerns such as near misses in the medication administration. Enhance existing safety initiatives with personalized support, like implementing statewide campaigns to catch near misses. Get guidance from our ISMP colleague, that leader in medication safety, to avoid medication-related adverse events. And then staying updated with the latest issues, medications, devices, and procedures to continually improve patient safety. I know that was a lot about the patient safety organization, a lot of it about the act. And what I'm going to do is I'm going to transition, and Sharon, excuse me, is going to be um, talking a little bit more about our services.
Thanks, Jerry. So Jerry provided a really nice foundation of what a PSO does and the value that it brings to healthcare organizations across the continuum of care. And I'm going to hone in a little bit more of ECRI, about ECRI and the ISMP PSO to let you know what we're up to and how we support our members across the country. So a couple of points. We are represented in over 90% of the US in the healthcare organizations that we support. And our member base includes over 500 hospitals and health systems, in addition to other care settings, such as over 200 medical practices around the USA. So we are a national PSO in scope, and we collect data from all kinds of organizations across the country. Next slide. A couple more overview points about ECRI and the ISMP PSO. As I mentioned, we were one of the first listed PSOs, so we've had the advantage of building a large database of adverse events, near misses, et cetera, in addition to RCA. So we are sitting at over 7 million events in our database and counting. And that's very important when you partner with a PSO, because what you're going to be able to do with your own data is compare with against that larger pool of data with like organizations. And I'll show you more about that in a bit. You're also going to have access to, 850 risk management guidance articles, tools, and other resources to have your entire staff access that to improve patient safety and reduce risk. We also have been very busy in collecting RCAs from our member organizations, and we have probably personally reviewed and analyzed over 5,000 of those RCAs and provided action recommendations for improvements. Next slide. So Jerry also mentioned the framework that we are working within, which is our total system safety. And our safety learning system is research, evidence, and practice based, systematically addressing the needs of healthcare providers. It synthesizes current research and best practices, analyzes patient safety events, and collaborates for improvements across the PSO community. And Jerry already touched more on this earlier in the presentation, so I won't go into more detail on that. Next slide. So what does ECRI and the ISMP specifically offer? Many of the things that a PSO, you already explained what that does. So we obviously help you with that legal protection of the submitted patient safety work product. Uniquely, we are positioned with our large staff of over 500 experts in different areas. We do support you by assigning you a dedicated patient safety advisor. And that's key because everybody's journey is very different in what they are working on. So you will have a one-on-one support with one of our advisors that will walk you through and educate you on everything that you have with the ECRI ISMP PSO membership and guide you into making improvements, sharing things about the data that you've submitted and trends, etc. So they are key to your learning and advancing as you continually work with the PSO hopefully over a number of years to realize those improvements. We also bring event analytics. So when you submit your data, your PSWP, we have a dashboard that will allow you to trend that data, do the comparisons against the larger ECRI database from other member organizations in a de-identified manner, and I have a screenshot later in the presentation of that dashboard visualization there. In addition, as a PSO, we don't want to just collect data and then let it sit there in a black box. We actually, as a PSO, you have to attest as a PSO that you are going to provide lessons and shared resources back to make those improvements and help those organizations show that they're doing, risk mitigation strategies. So ECRI has a large set of that. Some of you might already be members of some of those risk management membership programs that we have online, but that is also included in your PSO membership with us. Next slide. So you can see from this graphic, ECRI brings a wealth of experience and expertise, not only through the work we do as a PSO, but also alongside with our other teams of experts in areas such as medication and device safety, infection prevention, and human factors engineering. Our goal is to steadily advance transparency, safety, quality, and cost effectiveness of care across all care settings. So it's important when Jerry introduced us that our partner organizations really do play a huge role in helping support you, whether it's through our IS&P team members or our biomed engineers that are firsthand looking at devices and identifying potential issues with those. Those are the types of folks that we will get you in touch with should you have an issue, and you can have one-on-one conversations with those folks to help you learn about those problematic areas that might help with improvements on your end. Next slide. So with the PSO membership, you are provided a portal with username and passwords access. And that, again, is unlimited across your organization. So the more the merrier that gain access into these resources, get them down at the different department levels where they can really make improvements at the front line. So you will have access to all of this information, the risk analyses, the self-assessment tools on just about every risk in a healthcare setting. We have a huge repository of sample policies and procedures so you don't have to reinvent the wheel. Everything that we write and publish on in our website is evidence-based, so we are always looking at the literature. And with that in mind, we do provide a lot of references and hyperlinks to other source material when we publish our resources. We also keep you up to date with a bi-monthly newsletter that's pushed out to your inbox. So you will constantly be informed of any new information that we publish or educational opportunities out there for your organization. Next slide. Is that advancing, Jerry?
Yes, this is the next slide.
It's not showing up on my screen.
Okay.
Okay, there we go. So we also, with the PSO membership, which is on your portal when you access the member website, is you get access to a RCA toolkit. And as I mentioned before, we have a lot of expertise in this area because we've reviewed over 5,000 of the RCAs from our member organization. So we provide you with a template, and this is going to offer you consistency, ensuring that all necessary information is captured uniformly, making it easier to compare and analyze different incidents. We also provide this toolkit that has comprehensive coverage, which is helping you in systematically documenting all aspects of the analysis, ensuring no critical details are overlooked. The toolkit will also provide for efficiency in streamlining the process, thereby saving you time and reducing the likelihood of errors or omissions. And it also provides a way for tracking accountability, assigning ownership to specific individuals and departments so that completion dates and responsibilities are clearly defined and adhered to. So this is another benefit of your PSO membership. and can be downloaded and used throughout your organization. Next slide. So with the large set of data that we receive, we often do data snapshots that are published and that are loaded up there, all the archived information, as well as you will be informed of new ones that we work on. But basically, what this is taking a snapshot in time of our database and looking at a particular area such as falls or diagnostic safety or medication safety incidents or workplace violence. And we do a deep dive into our database, de-identify those events, and provide a nice little graphic here on a one pager saying how many events we looked at and the findings and trends that we learned about when we were doing that analysis. So these are been very popular on different topics, and we keep publishing them throughout the year. And I think they'll be helpful to you as well when you're analyzing a specific issue that you might be occurring in your own organization. We also have a number of education and learning forums with the PSO that you are welcome to join. One of our most popular is the safety sprints that we offer. And these are learning collaboratives that anybody can participate. We choose different topics. As you can see at the bottom, we've tackled a few important ones over the years, including staffing shortages, vaccine safety, workplace violence. Last year we did diagnostic safety, and then for this year we are focusing on maternal health. So these are really taking a mini deep dive into the safety, quality, and process concerns identified with the safety sprint topic. So you usually send teams to participate in these collaborative events, and you can take advantage of participating in all of the different webinars and micro learnings available in working through this issue. And I think, Jerry, they take, how long does a sprint take?
The initiative is actually about 3 to 5 months long. We generally do a kickoff in July, and then it goes into the fall. And this year, I'm really, really excited about the maternal sprint. It's going to be focusing on that transition of care. And this is across a continuum, right? So we have, the practices of the OB providers, and what does that look like when they're in the inpatient setting, and then are they getting that additional care afterwards? And we have what Sharon had also stated was, looking at the data. Well, we looked at our event data and our RCAs, and we collated information along with, best practices and recommendations, and then bringing in subject matter experts that have been working in the field. And it's just a nice way that you can kind of look at this from your own perspective and also glean information from others in the industry.
Thanks, Jerry. Next slide. Building on other educational opportunities available through our PSO, we've already covered safety sprints, but we offer a number of safe tables as well on different topics that you can see listed there. And you are also invited to a number of webinars. So throughout the year, here's just a sampling of the kinds of topics that we'll cover. We'll bring in speakers or we'll tap into different experts at ECRI. And these are all recorded. I believe some of them offer continuing education credits as well. And so you will have access to all the archived webinars in the past, and these are open to just about any staff member at your organization. Next slide. I've already covered these, but just a quick minute on this is that you will have access to all of these risk management modules in your portal. And as we mentioned previously, we have membership resources that are dedicated to different care settings. So we have an acute care focused through our health system risk management program. If you have aging services organizations that come along with you in the PSO, they would gain access to that aging services resource repository, and then we also have an ambulatory care risk management membership to address that outpatient care setting as well. So all of these would be included depending on, we have many health systems that bring the whole organization, not just their hospitals, but their clinics and their aging services organization for the protection purposes, but know that we have resources that will pertain specifically to those types of settings. Next slide. Jerry mentioned earlier in the presentation our top 10 patient safety reports. Our marketing department gets very excited about getting the word out on these. You probably saw it on LinkedIn or even through the ECRI website, but you're welcome to download these. We're actually collecting ideas for the 2026 publication already. But these come with, and here's the link right here. If you don't have access to that, it's a nice place to start in your own organization, just kind of a guide of what we're seeing out there and learning about as top issues out there. And these reports contain many different type of tools that can be used throughout your organization to monitor how you are addressing a particular issue identified through these reports. So please feel free to download that. We also offer our top 10 technology hazards report, which is going to be very focused on the medical device incidents that we learn about or main topics that are of importance out there in the field. Next slide. As you know, we have ISMP as part of our team member, and they just are terrific. That you will see some of those speakers on the webinar series, and they typically come on once or twice a year to cover what we are seeing in the way of reports on the medication events, which happens to be our top reported event in the PSO. So we are very fortunate to have those folks be a part of our team and consult with you as well as a PSO member on your particular experience and issues regarding medication safety. So they offer a whole slew of other type of resources out there, including proactive risk assessments and education programs, including their highly popular medication safety intensive workshop that a lot of pharmacists attend. So we'll move on. We wanted to bring up a couple of PSO success stories in working with our members over the years, and this is just a quick snapshot. If you wanted to obtain the full text of any of these impact stories, please reach out to Jerry or myself, and we'll make them available to you. But Jerry, did you want to just walk through a couple of these?
Sure. So the first one is really from a COVID-19 PPE quote mistake. We don't necessarily like to say that, especially in our Just Culture forum, but it was just really how the health system, avoided a costly, $1,000 PPE mistake. And this is where we have the value of our partners, especially right in our current situation, when we're also navigating PPE in shipments, et cetera. Even looking at it from the health system that reduced their health acquired pressure injuries, from a rate of 3.89% to just 0.58%. That's just amazing data when you really think about that and how they were able to do that. And these are just samples of some of the stories that we have within our across the spectrum. And that's really what this is about, right? As a PSO, we want to share those lessons learned across everybody. And that's really, the webinars and the safe tables that Sharon mentioned. That's the forum, and that's how we can come together. And that's the only way we're going to be able to get to that zero harm, and that we can work collaboratively together. In addition to, right, saving costs, because we know that that's the foundation as well. That's the only way that we're going to be able to be sustainable. And that's the last story. And that had to do with Claudi's in the 540,000 that they were able to save annually in that preventative measure. So I think Sharon's going to talk a little bit more about some of the additional add-on services that we have. A lot of the things that were shared already are part of that core, but we do offer some additional elements.
All right. So thanks, Jerry. So what I've outlined previous to this point here in the presentation was what we consider, as Jerry said, our core PSO membership, that everything I covered in there that you would benefit from. We do offer another layer of services that is very a la carte type of thing, depending on what your organization wants to focus on, that can provide additional value layered on top of your core membership. So these would include, for example, custom data reports. So we can drill into our database, much like I showed you those data snapshots on a particular topic. We could do the same kind of thing with your own data that's reported if you're looking at a particular area of concern and you want us to do a deeper dive with your data analysis. We also offer a time-saving mechanism for letting us do your research on a particular topic. A curated literature search is what we call these. And I'll go into more examples of that in a minute. We also offer RCA training and feedback on a personal level. We offer the ability to do your art culture of safety surveys if you don't already have a platform that does all of that data crunching for you and administration of those surveys. We have that available for all care settings. And then we also get involved in different collaborative and training opportunities. I guess you can advance, Jerry, if you want to talk a little bit about the RCA feedback and analysis piece.
Sure. So we actually have a framework that we have it within like 5 pillars. It's that investigation. It also has to do with the measuring and monitoring, the analysis, creating those timelines. And so our educational courses are built on that. But we also offer a service where we found that clients wanted to have that real-time feedback. Did they get to that true root cause? Did they get to the problem statement and that they identified the appropriate measuring and monitoring and that ongoing sustainability? And so what we have the ability to do based on, our experts, the advisor team that Sharon talked to you about, we will look at those RCAs individually. And we can look at them also collectively for themes across an organization in a common cause analysis or an apparent cause analysis, and really do some one-on-one coaching and really try to help look at it maybe from a different perspective. And so we've had a lot of valuable feedback from our clients that select this particular service. We've also actually jumped in real time that we are able to help facilitate for some of those staff members that may be newer or maybe having some challenges. But we just look at this as another opportunity for that collaboration.
Thanks, Jerry. Oh, so I alluded to the curated literature searches that can save you valuable research time. And these are another add-on service that you can add on to your PSO core membership. But these are really highly customizable based on what you're experiencing at your organization. We have about 4 or 5 full-time medical librarians that do our research and have access to a lot of different websites out there and clinical literature sources. So it's a matter of get in touch with your advisor and say, hey, I need a search on this, and we will pull that research together in a nice format for you and present that to you in a short amount of time. Oftentimes that'll include references to the clinical literature or study types out there, the clinical practice guidelines, and other related reports. Some of the examples of literature requests we've gotten in the past are patient discharge and transfer procedures for improving wound care and follow-up. Another one was best practices for managing arterial lines to prevent clotting. Um, Another example we had was using hallway beds in medical and surge units to manage emergency department overcrowding, and strategies for preventing sexual abuse or assault and harassment and misconduct in a hospital setting. So, very unique to that healthcare organization and what they would like a search of literature done on. And that's available to you as an additional service. Next slide, Jerry. I alluded earlier to the data visualization report. So if you are submitting data, and just so you know, we work with any risk management information service vendor out there where you are collecting your adverse event data already through that system. And you work with us on a mapping exercise to get that data coded over in certain fields to intake that data into our PSO database so that you can do some viable comparisons, not only in your own organization, but against the larger ECRI database. So there are different ways you can submit this data, and your advisor is key to helping you with that. But once this data is submitted, you then will have access to the events dashboard. I think I have another slide at the next slide. Yeah. So this is what a replica of what that looks like. Again, accessible through your portal. And you'll be able to view different things by event type, harm score, and compare your data to ECRI's larger PSO member database here. This is where you're going to be able to do trending and have time and date stamps on the event reports that you have already submitted. And there's all kinds of different features of this and different bar charts that you can play around with and export for various meetings if you need to present this data elsewhere in your organization. Custom data reports. I'm going to try and wrap this up in 2 minutes because I want to make sure we leave time for questions. But if you want data extracted from your database and have your advisor, or from the data that you have submitted and have your advisor do a custom report on that, that is something that's available to you, and then we'll work with you to gather the search criteria of what you're exactly trying to accomplish with your data report. And that's another valuable benefit, again, customized based on your particular needs at your organization. I think we've covered the safe tables already, so I'm going to skip that. There's other virtual learning programs that we have already built as well, many of them in the root cause analysis area. We have a foundational 2-day virtual program. We have been doing this for many years, and it's been a very popular program that many have signed up for. In addition to the foundational course, we have an advanced principles and practices course that people sometimes take the following year. And we also offer a few common cause analysis training programs, also virtually, and an FMEA course. Go ahead, Jerry. We also do the ARC Culture of Safety surveys. If you do not have an administrator of that currently, we offer all of the different care setting ARC Culture of Safety surveys through our platform. And this really is a time saver if you are trying to accomplish doing the data analysis on your own. It is a very huge undertaking and takes a whole lot of time. So our platform administers the survey to all employees and collects that data and does the actual analysis of the culture of safety survey data. So that could be an add-on as well to your membership program. Jerry, do you want to finish up with this? I think that's the last slide, and it has to do with the CMS patient safety structural measures.
Sure. I'm sure all of you are very, very familiar with the structural measure, and hopefully all of you are working towards that. These are just highlighted here with each of the domains of how we can certainly support you on that journey. Looking at from domain 1, the leadership commitment, and looking back to that total system safety, that organizational self-assessment. We do have that readily available, that we can support you on that and look at those results and help you come up with some of that elements of where to go and how to look at that. Domain 2, again, we have our Just Culture program that we can certainly help you on that journey with. Domain 3, the culture of safety and the learning health systems. Again, we have our culture of safety survey that Sharon has talked about. We have our root cause analysis programs. We have some other elements too of some of those resources that she had talked about, tiered huddles. How are you getting that information? Collating it from, the quote bedside or within your ambulatory care, and how is that escalating? What does that look like? And that follow-up, accountability and transparency, looking at that in a communication and resolution program that is built into the framework of our advanced RCA program training. But we also have some other tools and resources. We're actually doing a collaborative specifically on this right now with organizations across the nation. And how are we doing that? How are we doing that transparency and having those conversations? And that also includes that patient and family engagement, which is also incorporated into the trainings and the collaborative that we have. This last slide is really just showcasing some of those other elements that we have in the learnings. Like I just talked to you about the collaborative that we're currently doing with patients as partners in safety. And we know that that is a true element. And I was actually at a conference last week with risk managers, and it was really engaging and to have other presentations and how the patients are becoming part of that. When I was in my role with risk management a couple years ago, I'll say a couple, we didn't ever have the conversation with the patient. And we know that it's crucial that they are going to help us on our journey. So with that, certainly if there are any questions, please put them in the chat. I don't know if you have the capability of raising your hand or anything, but we're open to continuing the conversation.
Does anyone have any questions? Does ECRI support its partnering organization during litigation?
It's a good question. It's not the actual, the preparing or the depositions. We can certainly look at it and helping in the support of, getting back to that RCA or whatever it may be. Did you get to that true why? We also offer peer support programs, and I know that that's so important within the culture. How are you doing that? Because we know that the providers, including the clinical staff, when that event happens, they take a step back. There's a pause. We know that there's other consequences that may happen when they may be going into that next patient's room because they're self-doubting themselves. So we have a lot of elements that we can certainly do to support everyone, through that care setting.
And the other thing I mentioned is we do provide an attestation type of letter saying that you are formally part of the PSO. And that is provided and can be shared to leadership in your organization. Should anything happen in the legal environment, you will have that proof that you are part of a PSO, which is sometimes very helpful.
Yeah. Thank you for mentioning that, because I think that's that key element, right? That discovery of the information that you don't want to share, and that we will state, yes, we see this event sitting here, you're covered, you are part of us as a PSO, And we can absolutely support from that perspective as well. So thank you for bringing that up.
Yes, that's important. Are your services similar, the ones that you showed on your slides, to other PSOs?
All PSOs are not created equal. I will say that. If you go on the ARC website, there's over 100. Some are very specialty specific type of organizations that bring in certain, orthopedic practices or something like that. And there's others that are in the tech space, so I would consider that. Are they going to have experts on hand to address your questions right there firsthand and have that experience in a healthcare setting, or are they simply a data collection mechanism? Because that's not what the PSO is just about. So I would encourage, if you are, looking at different PSOs out there, to certainly sit through a demo and see what they have to offer. Jerry, I don't know if you have anything to add.
Nope, I think you said it well. Thanks. And I think it goes back to the advisors. I do know in the industry, not all of the PSOs have that one-on-one collaborative approach. And we have heard from our members specifically about that as well.
Thank you. I do not see any other questions unless anyone wants to put their hand up. We really appreciate you presenting today to Wikrams about this important topic.
Thank you.
Thank you for having us. And if there's other questions that you all get that you want to feed to Jerry and myself, please feel free in the future. And we're not going anywhere, so happy to address anything for you.
Thank you. Yes, I think your contact information, is on slide 3, and we'll make the slides available to everyone, the presentation as well as the recording. Thank you so much.
Thank you.
Very
Have
welcome.
a great day,
Karen
everyone.
and Jerry.